As we speak today, August is coming to an end. Health workers have not been paid salary for July. They have not been paid salary for August. Will end next week. How do you expect these health workers to go to work, to feed their children, to pay rent? You are embarrassing health workers in this country. If you are a health worker or a public servant and you have been paid salary and you don't pay for your rent and your landlord throws you out, Your Excellency, human resource policy requires that you are disciplined because you are embarrassing the employer, who is government. Now, since we are the ones being embarrassed, what do? Can we sack the employer? The only weapon given to us by the Constitution of Kenya under Article 41 is to go on strike. So we are asking, we open a conversation. Are we ready as Kenyans to continue having a healthcare system that is very critical in the hands of devolved system where only 9 counties, Your Excellency, in this country have had their budget passed up to now? 14 have never submitted their budgets. 24 have had their budget rejected. Are Kenyans ready to have the health human resource with these administrators who can't even have their budget passed, who can't even afford their budgets? Excellency, if there is something you did in this country that will always remember you, is to bring that man in the Ministry of Health. That Eden Twale to the Ministry of Health. And he has brought up a team that is actually working. Plus his PS, Uma Oluga, PS, the most smiling and the doors always open, Mary Muthoni, very welcoming and workaholic. And even Director General Dr. Moth and the entire team of the Ministry of Health. Your Excellency, these people are working today. Dear CGs, Your Excellency, we can say we have, first I want to admit, because I must speak with a clean hand, I was one of the serious critique of SHA when it came up. And you used to ask me, it is you who brought SHA because it is us that formed this government. Our issue was not about the services to be provided. Our issue, I was being pushed by the people I was leading. They were saying 2.7 was high. But I can admit to you, Your Excellency, that SHA works. Every month, I spend about 100,000 shillings supporting my people in my constituents. I pay between 6,000 and 12,000 every month. Everyone telling me I'm sick, I say, have you registered SHA? No, I cannot pay your hospital bill. Go, get assessed, send me the assessment, then I pay, you go get treated. It is working. Only that we have a few people who are very poor, they can't afford. You assess, somebody tells you, I have niko na nyumba ya mapati, kumbe the husband built a house and he died. So they give you pay 8,000, yet you cannot afford that. Maybe that's the area that may want to be revised. Your Excellency, I want to thank the Minister of Health. We have had problems, as my colleague said here yesterday. Every year we have been having problems at Ministry of Health internship. We fight, we destroy things, the Ministry of Health. There is one particular year where we broke things, the Ministry of Health, and the interns were surcharged. Today, as we are talking, under the leadership of your Apple CS, Honorable Eden Twale, there is no breakage, there is no mandamano on internship. That disease has been cured. Secondly, Your Excellency, the issue of universal health coverage, which you and your brother, former president, employed during COVID-19. Through his guiding and support and working with Parliament and all people responsible for revenue allocation, 8.6 billion was allocated for absorption of UHC staff into permanent and pensionable. But as we speak today, nurses in this country are on strike because the county government have refused to absorb these UHC staff. It is our prayer, Your Excellency, that national referral health facilities have acute shortage of nurses and other healthcare workers. Since you have the money, Why can't the Ministry of Health just take these nurses and other health workers to the national health facilities? Your Excellency, we can talk about medical products and technology, health information system. Of course, the health information system, Your Excellency, has worked very well. You know, that's why yesterday you said that Kinamugos have been removed from the system. I will want to say, under that health technology, health management system, they should be linked to the medicines and even equipment, so that if Governor Sakaja has supplied medicine to Hospital A, there is somebody somewhere who is in charge of looking at the system and knowing that this medicine is in stock. So that if a client goes and is told this medicine is not there, and he calls that number you want to establish, a person who is not in that hospital will be able to call that hospital and say, our system shows this medicine is in stock. Why are you not giving out to the public, the patients? For us as nurses, we are happy because, Your Excellency, our services we don't refer. Nursing services we cannot tell you go and get it outside. We will give it because we always have it. So we may not be actually affected by that. Your Excellency, a demotivated workforce, a workforce that has not been paid, cannot deliver services. As we talk today, yesterday, Your Excellency, you said all the county government received their share of revenue for the last financial year, 100%. County governments today, Your Excellency, have not paid statutory deduction and third-party deductions. They have not paid loans. They have not paid pensions. Some have not paid loans in the last financial year. As we speak today, August is coming to an end. Health workers have not been paid salary for July. They have not been paid salary for August. Will end next week. How do you expect these health workers to go to work, to feed their children, to pay rent? You are embarrassing health workers in this country. If you are a health worker or a public servant and you have been paid salary and you don't pay for your rent and your landlord throws you out, Your Excellency, human resource policy requires that you are disciplined because you are embarrassing the employer, who is government. Now, since we are the ones being embarrassed, what do we do? Can we sack the employer? The only weapon given to us by the Constitution of Kenya under Article 41 is to go on strike. So we are asking, we open a conversation. Are we ready as Kenyans to continue having a healthcare system that is very critical in the hands of devolved system, where only 9 counties, Your Excellency, in this country have had their budget passed up to now? 14 have never submitted their budgets. 24 have had their budget rejected. Are Kenyans ready to have the health human resource with these administrators who can't even have their budget passed, who can't even afford their budgets? This is a conversation that we need to open.
Thank you. Thank you very much.
Your Excellency, the last one. I cannot sit with people saying this. I'll be lynched by members. I'll be lynched. Your Excellency, in 2017, you and President Uhuru Kenyatta gave nurses a return to work formula, where you improved our terms and conditions of service. From that time up to now, that return to work formula of 2017, Your Excellency, has never been implemented. It has been a cause for 4 strikes, including the one that's going on right now. I know you have goodwill and you mean goodwill for this country. Through your goodwill, I'm requesting you to ask the chair of the Council of Governors to sit down with us on Friday, have a solution. And SRC should be on board. Because in 2017, we had that CBA, it was taken to SRC rejected. And today, even if we sit with Council of Governors and agree, and SRC rejects, the strike will still continue. So I'm requesting you, I know you mean goodwill for people, talk to the Council of Governors, SRC, so that we sit on Friday, because we have a meeting on Friday, we complete and send our people to go back and work. Thank you, Your Excellency.
Thank you. Do we have any other representative of healthcare workers?
Any clinical officer?
Okay. Okay.
He's up there.
Proceed.
Proceed.
Yes, and I'm very excited, Your Excellency, to be here today. I think the other time we met, Your Excellency, before you became president in Catholic University, I'm the one who gave you the memoranda on behalf of my good friends from the unions. And we have the other unions for public health and the other unions within the health sector with us here today. Your Excellency, there is something that you promised, and I remember you said that we keep the photos, so that in case you forget, we remind you with the photos. And Your Excellency, I think now I'll have to delete it. I was keeping it, but I never actually expected that we would have this forum. And you know, this is the first time we are having the head of state seated with us to discuss the matters health. We have been, as the unions for healthcare workers, even from the time our peers, Dr. Oluga, was a unionist like myself, Your Excellency, we were asking for health to be elevated to be a national agenda, and you have done that. And you promised when we met, you said that you are going to push for bold and deliberate reforms, and I'm happy that today, even those who are critical, and Your Excellency, I was one person who was critical at the start. One thing we agree on, they are bold and deliberate reforms. Maybe the other things that we are discussing is the implementation of the same. But where we are now, and you'll note that now the criticism has gone down, is because we have seen that it's working. I want to pick it from where my brother Ms. Keller and Seth Panyako have left. And sorry, I forgot to introduce myself. I'm Peterson Washira, the National Chair, Kenya Union of Clinical Officers. There is an opportunity within the Constitution, even without having to reverse ourselves to the national government. Under Article 189, the one that has been used to have cooperation agreement between counties and national government, it also provides that we can actually have joint authorities, either under the 47 counties or the 47 counties with the national government. And because what we are looking for is a unified system to manage healthcare workers, so that we have uniform standards across the board, for us, Your Excellency, we see a quick opportunity that if you can be able, through the Intergovernmental Coordinating Summit, deliberate under Article 189, it is actually possible to have a joint authority to be able to manage the health workers across the 47 counties under one authority. And Your Excellency, I must thank you because you inaugurated the KHRAC, the Kenya Health Human Resource Advisory Council. Since 2017, when the Health Act was actually enacted, this very important body that looks at the healthcare workers' welfare and the many things that are taking us on strike was very dormant, did not even have a board. But you took the step and you put it in place. And now we have an opportunity to be able within that system to provide some of the solutions that are needed for the same. So Your Excellency, for us, because you promised that you are going to be an arbiter, what we request is that you assist us so that we can have a joint authority. Within this joint authority and within the mandate of the KHRAC, we can be able to bring our specialists from the counties to that authority so that they can be available across all the counties, because the Health Act 2017 provides that our specialists are supposed to be a national asset. And that means that they should be available across the country. But with the current setting, that is impossible. If we have an authority, then they will be under that authority and can be deployed across the board. Lastly, Your Excellency, it is not only nurses who are on strike. We also have clinical officers, public health officers, and all the other workers other than the doctors. And especially the case of clinical officers is much easier because we had already agreed on a CBA, but there are some counties that have taken long to sign. We were supposed to sign on 2nd of February, and there was an invite from the Council of Governors. But as we sit here, only 16 counties have actually signed. We don't understand why the others have not signed. And it's something that, Your Excellency, if you can be able to mediate, we can be able to conclude very fast. Thank you, Your Excellency.
Thank you, Peterson. Now, that's quite a handful of manenos, but I think it's very good feedback. Let's begin, and I agree that machines, computers, medical commodities are all good. But without the personnel, they remain items. And they cannot, they cannot amount to service. For it to amount to service, people must be there. At the heart of health delivery is the health workers. And let me say the following. Peterson has put me squarely on what I said when we had the health summit before the last election. And I'm very happy to see you, Peterson. We have not met since that time. The problem, you forgot to come with the photographs. and I already gave you the leave. I told you, keep these photographs so that in case I forget, remind me, tell Mr. Boss tulikubaliana hii, unaona hii picha. But I guess you also agree that 80-90% of the things we agreed at the Catholic University, we have implemented. There are some outstanding issues, among them the issue you have raised, and I'm going to see how we can navigate so that we can take this forward. So human resource is a critical part, possibly the most critical part of the delivery of health as a service. To give it to the counties, and when I said I'm going to be an arbiter, you can confirm, and the chair of the Council of Governors here and the governors can confirm that the relationship between the national government and the county governments is way better than it has ever been. Because I deliberately chose to work with the counties, to engage in dialogue, and I must also say the counties have been very understanding. Whether it is the payment of CHPs, we've done it together. Whether it is the passing of the laws, they were always in the committees. Whether it is the equipment, the national equipment service, we have an intergovernmental partnership agreement. And everything else, we have worked together. Now, up to that point, we are good. You have raised, Dennis and my good friend Seth there have raised issues that I'm sure the council will want to respond, because this is not a place for judgment. This is a place for feedback, so that we're encouraged for the things we are doing right, and we are pointed out the things that are not going on in the right direction so that we can improve. It is true what I said yesterday, and the chair of the council can confirm that we have transferred all the resources for last year. We never crossed with any shilling belonging to counties. And the money for July was already paid. The chair explained yesterday the reasons why some counties have not paid the July salaries. But what these good people, representative of health workers, Dennis and Seth, are saying is also correct. You know, a whole, if